Hello, my name is DeAndrea Bolden, and you are tuned into the Faith and Mental Health Podcast. Listen, guys, as always, I have another amazing guest. I'm going to allow her to introduce herself. You know how I do. I don't introduce anyone because who knows you better than you? And me reading a bio is not too fun. So I'm going to allow her to introduce herself.
Good afternoon, everyone. My name is Dr. Kym Leonard. I am a board certified doctor of nursing practice, and I'm also a certified master counselor who specializes in mental and behavioral health and addiction medicine. I have a private practice in the metro Atlanta area, and I partner with local communities, regional and governmental entities to help them, especially since we have what we call it an opioid crisis, but I would say we have an addiction crisis. But I partner with local government. I partner with national government. I've even been consulting internationally when it comes to the collaboration of mental, behavioral, and emotional health and how it works in our spirituality. And so I am very glad to be here. I also am the founder of GKM. It stands for Global Kingdom Mandate. We're an international apostolic prophetic training ministry and marketplace business, and our headquarters is in Roswell, Georgia. And
Nice.
so I also have I'm the founder and dean of GKM Training Institute, and we have two school divisions. One is School of Counsel and one is School of Ministry. So I'm all about training and bringing knowledge to the people of God and people at large. My job is to build people.
Okay, I love it. We definitely need to cross paths. We'll be talking after I click the unrecord button because that was a lot, and a lot. But I I love it though. But I listen, so whether you want to or not, I will be adding you to our online directory, seeing that you have a private practice, and so that people that are in the Georgia area can take advantage of your services.
Thank
And
you.
so, for those that are tuned in, we're going to be talking today about the emotional side of thyroid disease. I know you're thinking, what? But listen, if you know me, I talk about integrative mental health. I talk about holistic health. I talk about treating the whole person and looking at all the aspects of a person's life because I believe that people are more than symptoms. I think we have to look at other things that are happening in people's lives and even see how one thing can affect the other. Somebody gets a bad doctor diagnosis, they may fall literally into a deep depression. Somebody, the wrong thing happened to a person in their natural life and it can cause them to start becoming extremely anxious. So we got to look at how different aspects of our life work hand in hand. So I want her to dive into this topic because I saw a post that she made, because every now and then I log in as Faith and Mental Health, and I said, well, let me see what all the people I'm following, what are they posting? And she made a post on the emotional side of thyroid disease, and I was like, this would be a great podcast topic. I'm finna send you an email because I love everything about this. But so I'm just gonna be quiet and let her just kind of dive into this topic because I think this is very, very important. And so I hope you heard her credentials already to realize she is a doctor of nurse. She's a doctorate level for nurse practitioner. So that means she is a provider, a medical provider that can see her own clientele and prescribe medication under the supervision of a physician. So let's I want you to dive into this.
Just kind of tell you, I'm just tad bit of background about me. One of the things that I've realized, and you kind of alluded to it, is when we practice, whether we're on the clinical side or the medical side, and I have credentials in both. I really didn't read all of it because it's too many pages. Okay. But what I really realized is that we practice in silos. And so where people who are, professional counselors or psychiatrists or psychologists, they never really tap into the medical side. And so as we were discussing, I practice holistically. And one of the things I do is to make sure that we collaborate when it comes to our healthcare. I cannot diagnose anything without understanding the emotion and mental health of a thing. And so
Mhm.
this is how I practice. And so I have had a wave of clients or patients, as we call it on our medical side, come in, and they would come in with a particular type of symptoms. And, for both of us, we practice as detectives. And that's what I call it. I saw a new series on there where they were advertising Sherlock Holmes and Dr. Watson, and then this is from the perspective of Dr. Watson. We are detectives, and so when a person comes into our care, it is our job to deduce what is going on with them. And I collaborate my career field with my spirituality. And so when I am looking for a diagnosis for my patient or my client, depending on where I'm practicing at, I'm asking Holy Spirit, what's going on? And so I had a series of women that came to me, and they were saying, I'm very tired, and I'm gaining weight. I've been trying these different weight loss programs. They work, but as soon as I stop their regimen, I gain all this weight back. I've been feeling very fatigued. I'm not in the mood to be a wife. I'm not in the mood to be a mother. I just want to get in my bed and rest.
Yeah.
And so, I'm looking. The first thing I go to, I've been practicing for 35 years, so
Oh, wow.
not a young chick, but I've seen a lot of things. And so, the first thing I go to, especially if I'm dealing with a female, I'm looking at their hormones, and
Yeah.
I'm doing a panel of lab tests, and I want people to understand that your blood speaks.
Very true.
Understand that, we are created fearfully and wonderfully, and our blood speaks. And so if I'm listening to symptoms and I want to make sure that I'm on the right road, I look at blood work. And so looking at a thyroid panel, looking at a female hormone panel, looking at your complete blood count, looking at your comprehensive metabolic panel, all of these things will tell me a lot about your balance and your metabolism.
True.
Looking at your cortisol levels, looking at your homocysteine. So, of course, this is what I do on these ladies. And I found out that and there's two unrelated, one Caucasian, one African
Mhm.
American, had a couple Indian, but it seemed like at a certain phase of life, these women start having imbalanced hormone. One of the things that we don't do in the healthcare field, a lot of times we treat the female a little bit different than the male. But I'm more likely to go with hormones when I start hearing those kind of symptoms than I do with mental health at first.
Mhm.
One of the reasons why I tapped into this is because of the clientele, like I said, was coming in, and I started to realize as I heard symptom after symptom, they started sounding alike, whether they were, white women, black women, Indian women, Hispanic women, started to have the same. I mean, it was just the same story, and so I started doing my little research because I'm a detective. And I realized that there is a relationship between your thyroid function and your mental health. Because one of the things that they function with the fatigue. They function and plow through, as a mother and a wife, and they're doing their business or they're doing their career. But one of the things that really upset them was that they felt like they were depressed, and it started making them the fatigue and the weight gain, yeah, played on their mind and their emotions. But one of the common threads in this is they started to feel depressed. They started to feel like they were losing themselves. A
Yeah.
couple of women said they felt like they were losing themselves. And so I realized and just kind of wanted to put out there. Anytime I learned something, and it might have been old news, but anytime I learned something, I try to convey it to the public because there's someone out there saying, "Oh my God, is that what's going on with me?"
Right. Somebody can
Thyroid
relate.
disease affect millions of people, male and female, worldwide.
Yes.
But we never think about the emotional or the psychological impact. We've never put 2 plus 2 together, especially in the medical world. We want to, throw a pill at it. And I'm not saying pill is not the answer, because
It's
sometimes
needed and
depending on
sometimes. Yeah.
what's the background of the malfunction of the thyroid depends on what we have to do with it. But while I'm deducing what's going on with these ladies, I realized that these symptoms, it would be easy for me to write levothyroxine, a prescription, and help them to get back to a balance of their hormone levels. But guess what? We still have depression. We still have self esteem issues. And all of that does not go away overnight.
Right.
And so we got the physical symptoms like the weight gain, the fatigue, and even some were experiencing hair loss. So think
Oh,
about this. Anything that changes your body, you believe it or not, I used to be 100 pounds soaking wet 20, 30 years ago. I've learned to embrace the new me.
yeah.
But as people are going through these, changes, a lot of us as women suffer in silence. We suffer in silence. Well, maybe I'm getting older and I'm gaining weight. Never thinking, do I need to go see my primary care provider?
Hmm.
Or I'm not feeling myself. Maybe I need to go see a counselor.
Yeah.
Because there's some things, it's a collaborative world and we've separated it. And so for me on the counseling side, if I get someone who's coming in and they're talking about they're depressed, I'm not automatically just thinking about their circumstance and their situations. The medical side of me says, well, when was the last time you've had blood drawn?
Yeah. It's important.
When was the last time you've had a physical and really checked out what was going on with your body? Well, I'm not quite sure, if this has anything to do with, I'm pretty healthy otherwise. But how do you know? How do you know? You haven't had a physical in 5 years. How do you know?
That's scary.
Life is happening. Our bodies is changing over time. Life is lifing. We have stressors. We have things going on. Believe it or not, just a little viral cold. Cold is a virus, can throw your hormones and your thyroid off. Did you know that?
Hmm.
Some viruses that get in can do some damage to our thyroid. A lot of people don't know that. And so while you're doing life, while you're taking care of the kids, while you're taking care of the husband,
Right.
while you're being the career woman, or you're building a business, guess what is going through all this with you? Your body,
Yeah.
your body. And for a lot of us as women, we are the last on the list that we take care of.
I think that's true because as women, we're nurturers and we're always looking out for everyone else. And so sometimes we do tend to put ourselves on the back
Yeah.
burner. But I want to segue and I want to talk about that post you made where it talked about the connection between thyroid function and emotions. It
Mhm,
talked about things such as anxiety and irritability, depression and fatigue, mood swings.
mhm.
Um, yeah, some of the common emotional challenges, feelings of isolation, self-esteem issues. I know we talked about the visible stuff, so I don't think
Right.
you mentioned the bulging eyes. That's another one that people can get.
Mhm. It mhm.
The
It
thinning in
it
the hair,
mhm.
weight gain, cognitive difficulties include
It's
things
a
like
lot.
brain fog, memory lapses, trouble concentration, concentrating, that can be a bit frustrating to people. And so the reason that that stuff is important is because having an issue with your thyroid is one thing, but when you add the connection to your emotions and your
Mhm.
cognition and things like that, those are the things that can impact your relationships. There was a study and folks was mad at me. I was like, listen, I'm just sharing the data, people. But it was talking about how, and people was like, well, I don't agree. I was like, this was a survey. So you're disagreeing with people are telling you about
Right.
themselves. So it's different between interpreting data and someone saying, I did this because of that. Now, I can't
Mhm.
refute if somebody says that. And so it
Right.
was a research study done overseas, and they were talking about how a lot of women felt like perimenopause played a role in their divorce. Some said it's why they got divorced. And so I think it's important to recognize that your physical health and things happening with your emotional health, cognition, and things like that
Mhm.
can have an impact on your relationships, things like holding down employment,
Yes.
financial stability. We have to really look at, so people just think, oh, thyroid disease, okay, you just you got part of your thyroid taken out, or you got it removed, or you took some. It's more than that. And so
It very much is more than that. And you look, perimenopause is a whole nother creature.
yeah, I don't want to get
But
not
and believe me, even through personal experience, I can talk about that. But let me relate this. Let me tell you the relationship, some of the relationship between the thyroid function and the mental health, because I would hate to clump it in one thing called thyroid disease, but
okay.
we have different disease processes that causes different things according to the thyroid hormone.
That's
And
good.
so when we talk about the thyroid hormone, we talk about the crucial role it plays in your metabolism, your growth, and your mood. Okay. And so when we have abnormalities in your thyroid function, of course, it's going to significantly impact everything about you, your mental health. Think about this: when you have hyper, which is an overactive thyroid gland, it causes anxiety. It causes nervousness. It causes irritability. It causes difficulty concentrating. It causes sleep disturbances. It causes mood swings. So
Mm.
I'm going to place with what part of the thyroid diseases causes what. Then we have your hypo, which means your underactive thyroid. That causes depression. That causes fatigue. That causes your thinking to slow down, your cognitive impairment, where
Mm.
I can't process. People call it brain fog,
Yeah.
but I can't quite think. Or I go into a room and I forget what I go into a room for.
Yep.
Or I've done something, and this is crazy, and this has had everything to do with the perimenopause and the menopause, but it's still a hormone. I have been on the phone with people and say, hold on for a minute, I need to see where I put my phone.
Ah!
I have had glasses on my face
Looking for your
and
glasses.
looking for my glasses.
Yeah.
And so you see where we're talking about brain fog, we're talking about apathy. There is so much, and you even
Yeah.
brought up, even with the hyperthyroidism, your physical appearance change, your eyes bulge. Can you
Yeah.
imagine? We have to pair this with my self-esteem. Now I don't even look myself.
Yeah.
I've gained 50 pounds in the last year. Think about all these things and how it plays on your emotional and your mental health. So, guess what? Let's connect the dots. My emotional and my mental health is in my soul, it's connected to my will. So, if I'm laying in the bed and I just don't feel like it, I may not feel like praying. I may not feel like reading. I may not feel like connecting, and I'm spiraling downward. And so you talk about, yes, how is this going to affect your marriage? Because now you're living with a person that does not understand, unless they are in the medical field. You're experiencing some things that they just can't connect to, because only 20% of thyroid disease affect men.
Mm.
Okay. So
Wow.
let's I'm going with numbers, but I want to kind of put it because can we say sometimes or most of the times it's a female?
Yeah.
disease process going on. So now I'm living with the person and I can't relate to the person because I'm so tired. So I can't be intimate with the person because I'm so tired. I don't want to go out with the person because I'm so tired. I've gained weight. I can't fit in my clothes. Think about all the things I don't feel pretty. I'm not going out and getting my nails done. I'm not going out and getting my hair done. I feel like a pig. And I don't like myself. So why should you like me? Now we're talking about emotions. Now we're talking about the tailspin of my mental health.
How many people do you feel, or do you know any statistics? You may not have it, may not even be available, but is there any statistic on people that are dealing with thyroid disease, the percentage that actually get the mental health counseling to help them work
Ah,
through some of these things?
you know what? I don't have direct statistics, but I promise you it's less than 10%. I mean, just by profession, even having the flow of people that I've had through my practice over the years, me connecting the dots with them and helping them to realize if I had not recommended therapy, if I had not recommended marital counseling, if I had not recommended counseling or individual counseling or group counseling, because think about this, the human, there's human nature for us to find comfort when we're going through such things.
Right.
And 9 times out of 10, the comfort that we find is not positive. We may find comfort in eating more food, although we've already gained 50 pounds in the last year. We may find comfort in drugs and alcohol because they help us to forget our current situation. Me and my husband are at odds, and I don't have the intimacy that I had with him. But this alcohol makes me feel okay. I'm not stressed. I'm not anxious. I'm just in my chill mode. Or we may find comfort in smoking marijuana or I guess what is it, the hookah pipe? I might not be saying that correctly.
The hookah
But
lounges and stuff. I
yeah,
just see the thing. I know what you're talking
you
about.
know what I'm
Hookah.
saying,
Yeah, yeah.
but think about the
Vaping too.
things we already have trouble in our body, but we're trying to soothe our mind. We're trying to find
True.
comfort where comfort is not. We're at odds. We live with a person we can't relate to. They can't relate to us. And if they're not in tune with us, they may find comfort somewhere else.
Yeah, it's true.
And so you're talking about you mentioned the possibility of high divorce rates. I don't even know if those statistics have been even investigated. But think about this. And then we think about our male counterparts who may be having hormone issues of their own when we're talking about the male hormones.
Hmm.
So you got two people maybe going through their own crises, and instead of, investigating and finding out what's going on with me, or my hair is balding and I feel like I'm losing my mojo, let me go find a woman half my age. Okay, we won't get into that.
Ah!
But we but there's we look, Houston, we have a problem.
Yeah.
We have several problems. And we're talking about the thyroid hormone, but believe it or not, it's every hormone in your body connects to another hormone. So guess what? If my thyroid hormone stays in imbalance, it may affect my female hormones. It may affect my cortisol levels. It may
Yeah.
affect my homocysteine levels. And now I'm anxious and depressed.
It's a lot. It's a the human body is
It's
complex, and then when you tie that into other things, it's so much to it. And so I want to know, before we get off here, I want to know, is there anything from so this is asking you for as a medical professional, is there anything people can do? Is there anything people can do to avoid issues with their thyroid? Are there any lifestyle changes that are associated with a higher risk of thyroid disease? Are there any, when you look at stuff, so like, I'll give you an example. So like your diet, a poor diet and lack of exercise puts you at greater risk of developing type 2 diabetes. Um, is there anything like that with thyroid disease? Is there anything that people can do to reduce their risk or to reduce the likelihood of developing hyper or hypothyroidism?
Well, it's a very complex disease, but one of the things that you can do is to make sure that you do have a healthy diet. One of the things that I recommend, because remember I told you even something as small as a cold can throw your thyroid off kilter. And
Mhm.
so think about how we do and we don't build our immune system. Right now,
Okay.
we're in the throes of flu A and B. I also put an article up there called the Quademic, because I get CDC reports, and right now we're in the midst of we call it quad because it's four viral things that are going on in the body in 43 states in the United States, very hot. But what I do in the winter months, and I do it just so I can keep my immune system up, is I go on a regimen. Well, I can maintain a regimen of vitamins. I recommend vitamin B complex. I recommend vitamin C 1000. I recommend zinc 35 to 50 milligrams a day. I recommend vitamin D 5,000 international units a day. I recommend these things because if we are to keep ourselves balanced, our immune system has to stay balanced. So sometimes with the thyroid disease, it can become hereditary. And so we can't do anything about that. But we can
Right.
keep our immune system up. We can keep our stress level low. We can keep our annual appointments with our primary care provider to make sure that there's something that we are healthy as we believe we are. I've had many people over the past few months, people, young people have died, or people, in their 40 or 50s died, and everybody wants to holler, oh, they were so healthy, but they hadn't seen the doctor in 10 or 15 years. How do you know you are healthy unless you have the evidence of your blood speaking and saying you're healthy?
Wow, 15 years. Yeah, I try to get to the doctor every year to get my blood work done. 15 years is wow, that's a lot. That's a
But
gamble.
and last but not least, I want to speak to the people of color, because when I hear those numbers, I usually hear those numbers from people of color. You say you're healthy, I don't have a need for a doctor, and the only time you go to a doctor is when you have symptoms. But I want to say with certain disease processes, when you have symptoms, it's too late. So we got to do better by our bodies. We got to do better by our bodies. That's one of the things that I am an advocate for. We need to know our numbers.
That's good. That's good.
And we got
Wow.
to deal with our mental health.
Yeah. Can't get mental health is health. So yeah,
It
can't get
is.
around that. So I wanna say thank you to my guest, Dr. Kym Leonard. I and also thank you to those that have been tuning in. But what I want to do is give you a few minutes to close us out, let people know how they can contact you, how they can connect with you, if you have a branded social media presence that they can follow, let them know where they can follow you and all that good stuff.
Okay. Well, mine is very simple. I have a website that is called askdrkim.com. My Gmail address is askdrkim@gmail.com. My Facebook is Ask Dr. Kym on Facebook. And all those avenues, you can get in touch with me and I can help you the best way I possibly know how as a counselor and a medical professional. Thank you.
I didn't went on your website now. So thank you to everybody that tuned in. Like I say every time, until next time.